So that's a lot of what happens to the mother. But let's have a little look at what happens to the baby. So when a baby is being born, as I've said before, mother is lying on her back, being given maybe a big dose of a pain-killing drug, which is going into the baby, which is going to slow them down, so slowing the birthing process down. This means that that child is in the birth canal for longer than necessary. There may be problems because of the cord being wrapped around them or something like that. There may be just the length of time that they're going through the birthing process. This can starve the brain of oxygen. So then we're looking at, and it's been proven now, that this is a link into autistic spectrum disorders, things like dyslexia, dyspraxia, ADD, that's attention deficit disorder, attention deficit hyperactivity disorder, ADHD, anxiety, fear, reading and writing issues. All of these things can be linked to the birth trauma of the baby being in the birth canal too long, and their primitive reflexes not being leaving them. They come in round about 9 weeks or something like that, so I've read round about 9 to 11 weeks into the pregnancy, and then they lose those natural primitive reflexes till between 6 and 12 months old. But if they don't, because of the delay and the trauma that's going on through the birthing process, or maybe the forceps were used on them, which squishes their heads, and that's got to have some kind of an effect on their brain as well at some level, and the blood vessels and the supply to it, that later in life, and it's not necessarily straight away, that this can lead to diagnosis of ADD, dyslexia, autistic spectrum disorders, and this kind of thing, that then when the parents realise there's something going on, they're taken to a doctor who is not necessarily an expert in this field, and they may be offered very intense drugs like Ritalin, for example, to calm their child down because they're being hyperactive in school or nursery or kindergarten or something like that. And that can happen when they're at school, but when they're at home, they're fine. So it's not even something that can be picked up on very early in life. There are certain things that children and toddlers will, show signs, like lining things up in a row. An interest in dinosaurs is one. Really sensitive and fussy about foods is another one. These are all just fairly normal things that you wouldn't probably associate with autistic spectrum disorders. But then when they start to go to kindergarten and school and they're mixing with other children, they're affected by the energy of all of the other children around them and the stress factors. Because they are more sensitive, they may come from a calm home environment, then this is when problems start to show themselves. And they're lucky they'll go through the processes that it used to take 18 months to be diagnosed with something like Asperger's or autistic spectrum disorder or something like that. These things can be helped, but it's linked into the primal reflexes, the primitive reflexes that are in the system, and the problem with the birth, and this affects them, and it causes neurodevelopmental delay. So it affects the central nervous system, and this affects the whole, the child's sensitivity on many different levels. So we've got this going on with babies as well. So healing birth trauma for mother and the child is a big deal. It can make, huge difference to problems like autism and things like that. And autism isn't just, it's not just linked to people. You say autism to people and they think of children that are completely non-communicative and possibly, labelled mentally disabled or something like that. There are very autistic people out there that are highly functioning and don't even realise that they've got autism because it's never been brought to their attention, or they're not even diagnosed until they're 40, 50 or 60 years old. So this isn't something new, but the amount of diagnosis of ADD, ADHD, that type of thing, is just expanding and expanding and expanding. And some people think it's because of the distress in hospital birthing instead of home birthing, where we'd be in a more natural environment. And I've read books about way back in the day that it was important on a spiritual level for a child to be born, if possible, in the same room, in the same home that the child was conceived, because there's an energetic match going on there. That's probably a bit deep for some people, but we are all energy at the end of the day. So we've got all these things going on, and they all need to be taken into consideration. So I specialise in healing trauma, helping people heal trauma, bring themselves back into balance on, all of these different levels, bringing the soul fragments back into the system, resetting the nervous system so the anxiety is affected, taking away the cell memory. All of this gets stored in the cell memory, and it can lie dormant for years and years and years. Cell memory is an energetic consciousness issue that leaves residues of what we've experienced in our lives in our cells. So you imagine going through life with a lot of past trauma in your cells from when you were a child or when you've given birth. And then as you get older and older and the other stuff compacts into it, the cell memory from the divorce or from, much loved dog that passed away, or losing your parents, or losing, someone you love. All of this gets compacted, and then we're back to what I said earlier about when we get older, the diseases start to form because of these imbalances in our energetic self. And your cell memory is consciousness. Everything is consciousness. Everything is energy. So it accumulates over the years. So it's really important that we take care of ourselves on the level of mind, body and spirit. And when I say spirit, I mean the energy that is in and around your physical body, and the consciousness that actually forms the physical body and everything in our field. We've all felt vibes before. So consciousness is the vibes. You've gone into a room where somebody's had an argument, for example. You can feel the bad vibes in the air. This is consciousness. That's what some street term is, vibes. Consciousness is consciousness. Energy practitioners will talk about energy, and chakra systems and colour practitioners will talk about colours. All of it's consciousness. Everything is consciousness. So our consciousness is deeply, deeply affected through birth and being born. So this 45% that the NIH is saying, birth trauma, they're talking about serious, birth trauma, something going wrong. My guesstimate would be 90% of women out there have some sort of, even if it's mild PTSD symptoms linked to motherhood and giving birth and the trauma and, the pain and the fear and the anxiety of the whole situation. And that later in life can cause problems and to serious diseases. So it's something that needs to be looked at. It's something that needs to be considered and dealt with. People need to heal themselves, particularly now. There's a lot going on with the vibrational frequencies of the planet, and it's affecting us all on the level of consciousness. Consciousness is not just what you have in your mind. Consciousness is your body, it's your cells, it's your energy field, it's your chakra system. All of the things I mentioned earlier, whether it's energy healing, whether it's psychological consciousness healing, whether it's physical, everything at the root of it is ethers, and the energy of those ethers is affecting your whole health system. It's affecting your life. It's affecting the way you perceive reality and how reality shows itself. It reflects back to you, so it's projected into the world around you. So if you've got a lot of trauma in your system, from past dramas, hurts, accidents, deaths, whatever that is, giving birth, then that trauma is going to be projected into the world around you. Then we're into the law of projection.